Okay. And I think we are, can you see we're recording?
I can.
Okay,
Yeah.
so we are recording. Welcome to our chronic disease section. Today's guest speaker, we have Dawn Littlefield Gordon. She is the Obesity Prevention Coordinator with the Maine CDC. She's going to talk a little bit about chronic disease and how she helps mitigate, eradicate, and work on this problem in our state of Maine. So go ahead, Dawn. Tell us a little about yourself.
I'm a little bit laughing because eradicate's a really good word for obesity prevention. So thanks for inviting me, and I'm excited to speak to you guys today just because I think that the work that I've been doing for the past decade for the state health department on obesity and chronic disease prevention is so important, and we have a lack of capacity really within the state and ongoing with public health anyway. So thank you for wanting to look at public health and chronic disease prevention in advance to all of your students. As far as my work goes, as a public health obesity prevention specialist, I'm a more of a generalist, and I cover chronic disease prevention, but my specialty and my focus is really in physical activity, nutrition, and population health-based approaches. So that's a little bit different than a direct service approach. And a lot of people think, oh, what do you do? I have friends that are like, so do you go in and treat people for obesity? No, public health is more of a population health approach to things. And I try to explain that it's environmental and policy change. And a lot of times my kids and my husband will say, so you go to a lot of meetings. Yeah, I go to a lot of meetings. The crux of our work is to bridge gaps and to really find common areas that we can work with other programs within the chronic disease programs, but also with our partners. So higher institutions is a partner, hospital systems are a partner, providers are partners, WIC, child cares, schools, all of those settings are how I do my work. So over the years, it's been an evolution to be able to look at how to tackle these problems. So I'll start first with a little bit of obesity in general. So obesity has been identified as a chronic disease, and just recently there's more and more evidence that supports that this is an ongoing chronic disease that relapses and is something that needs to be diagnosed early and treated, but also really prevention efforts need to be stepped up. So the other important thing to note about obesity and obesity factors are they underlie most every other chronic disease. Anything from cancer to cardiovascular, which cancer in our state is the leading cause of death in Maine, but nationally, cardiovascular or heart disease is the leading cause of death for adults in the United States. Then we have things like liver issues and not just cardiovascular, but I think going into Alzheimer's, arthritis, any kind of inflammatory or immune system issue, it all relates back to what you eat and how you live. So in order to prevent that, it's really important to start our interventions at the most earliest age that we can. And a lot of times that would be prenatally. So, it's a strategy that we've talked about in our state and work with Let's Go out of the Barbara Bush Hospital is really the first 1,000 days approach. So not only when a woman prepares for pregnancy should she be eating healthy, but also through the span of her pregnancy, she should be trying, if she's able to, get physical activity and eat healthy so that when her baby is born, the baby has the best chance of having healthy habits. So I always talk about healthy eating, active living. So HEAL is the approach that we use for obesity prevention. And that's a broad way of looking at making healthy choices the easy choice for everyone so that there is health equity across the board. And it's really top level, but I think that it speaks to how I approach the work. One of the things I think would be interesting for you to know about public health is that when you graduate, and we get a lot of folks that come at it with their master's in public health, and they come to the state health department and they think, oh my God, I'm going to be able to really impact people and I'm going to make a difference. And you get into a system. Now, those of you that have worked in large health systems or in businesses, maybe this is your second career. If it's not, if it's your first career, let me tell you that you have a little bit of a surprise when you come to a state health department. There, it is a system, and you have to get used to doing things that may seem obstructionist, if you will. That means that you have to learn how to do contracts. You have to learn how to measure your success. So everything you're doing in school right now, if you're having to write justification or rationales, this is also important, because when you get to work, you need to be able to sell yourself to the federal government if you're writing a grant, because most of our funding is soft money and it comes from the federal grant, the federal government. You have to be able to justify to your own department what your outcomes are. So understanding what epidemiologists' reports are, or even being able to look at the data and being able to interpret the data is so important. And a lot of students that I've had experience working with, if they don't come from a EpiLens, have a real hard time with understanding spreadsheets and data. So if you have the opportunity in your experience to learn more about data, please dig into it. It will help you so much in a public health career. And then some of the other things that I think are super important are understanding that just because you come out with a master's degree or even a PhD doesn't mean in a public health realm, you're going to get the top job. Sometimes you have to learn from the bottom. And that's really difficult when you've spent a lot of time and money and invested a lot. And I'm not saying this to scare you from doing this. I don't want to do that. I really want you to, have a real life understanding of what it's like to get into a public health career. You're not going to probably come in as a director. You're probably going to come in as a health educator. And that's great, because then you learn how to work with different people. You learn how to manage coalitions. You learn how to develop partnerships. And it's really, really instrumental to be able to be very well versed in both verbal skills, but also written skills. So I know it probably sounds like, wow, that's not at all what I was thinking public health is. Those are the foundational things you need to be able to do your work. Tara, do you have anything that you wanted me to highlight?
Well, just a couple of questions from what you just spoke about. Well, first, I totally agree with you on the school thing. And one thing I do hammer home in our program so far is that it's not just getting a degree. You have to be able to learn soft skills and people skills, and everything you do in your school program will help you eventually, but you're not just guaranteed a job, or you're not just guaranteed a certain title. So I'm glad you touched on that. That made a lot of sense. One thing that I was wondering, so as far as like the Let's Go program and a woman that is hoping to get pregnant, how would she hear about a program like this?
So the Let's Go program, they have settings that they work in. So they work in the clinical setting for 5210 pediatric practices. And that is more of a messaging and a screening they do obesity prevention screening. But as far as the approach, 1,000 days is an approach. And medically speaking, that's something that across the board, American Academy of Pediatrics has been promoting for a long time. So more than likely, if you're getting good care already, and you have a gynecologist or a pediatrician that you've been talking to, they'll already know about that. If you don't, then, and you're going to family planning, let's say, for your medical care, a lot of times, it's just because we're such a small state, it's just understanding the importance of good health yourself. And it's not like a program that's being promoted. So I'm sorry if it appeared that way. It's just an approach.
Right. And that's something I was going to bring up. I think we all have a personal responsibility, but would you agree that part of that personal responsibility would be to share knowledge with others, even if you're not holding a title as a community health education specialist? Like, we still have a personal responsibility to civic engagement and sharing with a friend. If you know a friend might be struggling with something, share what you know.
Oh my God, that's so funny. Yes, absolutely. So a lot of times my professional life spills into my private life and vice versa. I started my career as a fitness instructor and managed a health fitness community program fresh out of, I hadn't even finished my degree, but that was my passion. And, I got my degree in nutrition and then went on to develop some programming for schools on healthy eating, active living, and was really a subcontractor. And then I got into working with underprivileged children and was a recreational therapist. I was certified. I didn't finish my degree in therapeutic recreation. However, I brought everything that I knew from fitness world and the background I had to that program. And so all my life, my career has been cross-pollination. So not only do I think it's important, I've always lived this way, I really have a hard time separating that. So I can't be one way, professionally and not have it spill over. So if I'm having a conversation with my hairdresser and she asks a question about, COVID, and because I'm at the state health department, I know, what's going on with our precautions. And so, that's one of the beauties of being in the know around public health. And so if somebody says, oh, my son is having issues with cholesterol, I can talk about what are some areas that they might, who should they talk to, number one, what should they be asking their doctor? And, that's one of the things I think is so fortunate about being skilled in the chronic disease prevention areas.
Mm-hmm.
I don't know if that answered your question directly.
No, definitely. I like the word cross-pollination. I think it's really important to share what we know, and just, if you're going to be in this field, it's important to have that sort of helper mentality. Like, we are here to help. We're not here to diagnose medical conditions. So don't think you're supposed to figure out what people's problems are. But if you hear of any sort of struggle in any different kind of area, fitness, nutrition, stress, things like that, it's about understanding what your resources are and where people can reach out for help and things like that. So cross-pollination is a great term. I'm going to use that. It might be good to talk a little bit about, because we're going to cover this in our textbook, but I think typically there's like this preconceived notion that chronic diseases only affect elderly people. And ultimately, chronic diseases have emerged because we do have a longer life expectancy now, because we've been able to somewhat control infectious diseases, compared to the 18th and 19th centuries. But now we're seeing chronic diseases in other ages. Do you have any experience working with a variety of ages? I mean, you've talked about the 1,000-day approach with prenatal and young children, but we're starting to see diseases in children now.
That's right. So my focus has been on early care and education for over a decade now, as well as general population. So I focus on working with child cares to improve policies and practices that support healthy eating, active living. So in other words, getting healthy foods to those kids, but also providing educational opportunities to parents and to providers, because you only know what you know. And if you don't get the information, it's hard to understand why is it important to not drink soda. That's a big one. So, we have seen the research over the years that younger and younger children are getting cardiovascular disease, and a lot of it has to do with the processed foods that they are ingesting earlier, as well as there's just a recent study about, again, that 1,000 days, what a mom eats when she's pregnant, especially if it's a high fat, high processed fat diet, high sugar, high refined flours. Her likeliness of having diabetes herself while she's pregnant is very, very imminent. But then the secondary piece is her child is probably going to have more chronic diseases as they age and at a younger age. So a really important thing that we're seeing in the cancer area, because we just did a presentation on obesity and cancer and the connections. There's over 13 cancers that are associated with obesity now. And with with the trends in obesity, we're seeing younger and younger populations that have early onset obesity. Cancers, the rate of cancers, because it usually takes a decade by the time that there's a predisposed predicator for it. You see a decade before you actually can see the spikes in some of the prevalence. We're starting to see an 18 to 44 age population, which is not ever something we followed with cancer, starting to have early onset cancers and associated with obesity. It's really something we need to start looking closely at, and following that disease pattern, as well as onset of diabetes. So years ago, diabetes is the perfect example. So years ago, young children weren't diagnosed with type 2 diabetes. Type 1 was what you heard for young children. That is something that's genetically predisposed and you can't prevent. You have to treat. Type 2 diabetes is the preventable diabetes. So now there is such a high prevalence of kids with type 2 diabetes, it's out of control. So we're struggling not only with the younger kids, but now as you age and you're living longer, as you say, chronic disease affects your quality of life. So if you're on 5 or 6 medications and you don't have a high income, how do you pay for medications? And you can't get, so there's so many areas that this chronic disease prevention impacts, but overall, not only the health and quality of your life, but also your economic drivers. So it's hugely tied to this, I don't want to call it an epidemic, but it's just definitely the way that we've changed our predicators for health. And you're absolutely right. No longer is infectious disease the number one killer. It changed about 50 years ago, and now, or even more, it could have even been 100 years ago by the time that if we really teased it back. But
yeah, that's important to understand all of the different drivers. It's not just your personal health, it's our population health and our economic health, and ultimately
environmental health also plays a huge role.
Definitely. Yep. And ultimately, this is the mission of public health, is to prevent premature death and to improve quality of life for a longer period of time. So we don't want to just treat a 30-year-old person that has type 2 diabetes. We want to try to get ahead of that. So I think a lot of these interventions are aimed at prevention and prolonging of life and quality of life. And I think you just described it perfectly.
I think the other thing to note with the prevention of things that you can modify. So modifiable risks are what we try to focus on, and tobacco is number one. Tobacco with any kind of chronic disease just exasperates it. So, of course, asthma and, obesity is the second, and almost rising to an equal setting, if you will, as tobacco, as one of the main things you can do. It is one of the most self risk mitigation areas you can focus on. So tobacco, healthy eating, active living. So obesity.
Awesome. Now, someone who is either currently in a bachelor's degree program or will just be graduating, and they're passionate about these modifiable risk areas or healthy eating, active living, what would you suggest would be a great place to get started for them? And hopefully during their program too, they'll have an internship. So are there internships available where, like in your department, or, and not to put you on the spot or anything, but where would you send someone?
So we do have folks that come into our program. A lot of times it's epidemiologists, and folks want to be interns there to learn about whether they want to move forward with that, which right now with COVID be a great learning opportunity. I think it's harder for us at the state health department because we have a limited capacity, and we feel really a vested interest in students and really want to be able to give them the best experience. So sometimes we have to juggle our responsibilities with that, but definitely you could reach out to the state health department. There's also other nonprofits that take on students. So I am a subcontractor with medical care development, public health. We have a lot of students that graduate and come to us. We've done a lot of internships and people that have stayed on with us. So I think that they're a really great resource. MeHalf, which is a nonprofit grant funder, they're a great opportunity. And the reason I say a grant funder is because if you are a student, one of the best ways to learn is to maybe get into the nonprofit world a little bit and see how they fund the work, because they do a lot of community funding and a lot of capacity building with coalitions, and that's really where you get the biggest bang for your buck. So community coalitions and public health entities in general are great places to connect with.
Awesome. And we do have a few of those here in Aroostook County as well. The Aroostook
Yes,
County
you do.
program. There's Pines Health Services. Yep. So we have quite a few resources right here in our area, but it's important to know other areas in the state and agencies as well. So
and Bangor and Portland have their own public health, their municipal public health departments, and they're recognized. So there's two public health departments that also would be a good place to look at.
Great. Awesome. Well, thank you so much. That covers all of my questions. That was a great presentation. Do you have anything else to add, or?
Well, thanks for the opportunity. And if you have any questions, feel free to reach out. You have my contact information. So it was a great opportunity for me as well.
Awesome. Thank you so much, Dawn, and have a great day.
You too.
Thanks. Bye.
Bye.